Good evening. Excellent. Thank you so much for joining us here tonight on this incredible time where we look back at 80 years of serving the community together with you. There's three things that Jessica and I want to accomplish tonight with you. Number one, we want to talk about what is compelling us to move forward. What is it about today that's compelling us to look forward over the next 80 years? Number two, we want to share with you a journey that we've been on for the last 5 years at House of Friendship and with our community partners. Number three, we want to share an audacious vision with you tonight and invite you into that vision as a community. It is a vision that is way beyond House of Friendship. It's actually not about House of Friendship. It's a community vision that we want you to be a part of. So are you still with me? Compelled, journey, and a vision. Now, in order for me to keep my job, there's two things that need to happen when you walk out the door tonight. Number one, that the vision that is shared tonight is crystal clear to all of you. That tomorrow morning when you run into a friend, or Monday when you go to work and someone says, hey, I heard you went to that dinner, you went to Lot 42, you thought you were going to Oktoberfest, but it was actually a House of Friendship event, just wondering what happened there that night, and you could just clearly tell them about the vision that was shared. So that's number one, for me to keep my job. Number two, that would be really helpful for me and allow me, when you walk out the door, is for you to be able to clearly see how you can be part of that vision and your role in it. If that does not happen, this will be my last chance with you, so I just want to say it's been an absolute pleasure serving you for the last 10 years. It's been an honor. I want to wish you all the best, and thank you for coming tonight. 80 years ago, a small group of women came around a table at an incredibly challenging time in history. There are enough of you that know exactly what I'm talking about with the economic depression, the dirty 30s, and the impact that that had on people's lives. And yet in the midst of this incredibly challenging time, we're on the brink of a world war, we've got economic failure. A small group of women in our community came together and did something about the issues that they were starting to see in our community. And that's why we're all here today, 80 years later. And so, what is compelling us to move forward? In a time where, when you and I pick up the paper, read the news, and we're just bombarded with the same headlines day in and day out. We've got poverty, homelessness, we have the opioid crisis, mental health, addictions, and all these challenges, and it feels overwhelming. And a part of us just wants to be numb to it all because we don't know how to do it. And I'm sure the women that came around that table 80 years ago must have felt that overwhelmed themselves, but they did something. And so tonight what I wanted to do is I've asked Jessica Bondi to join me because she's our housing director, and with her incredible housing team, some of who are tonight with us, have sat down with the individuals we serve, and we wanted you to hear their voices about their experience in today's context so that we're not numb to the need of this community, and just wanted to share that with you. And I think then you'll get a little bit of an insight into what compels all of us to move forward even in these difficult times. So, join us at the table conversations. Jess, thank you for coming here tonight.
Thanks for having me.
I did suggest that you dress like one of those women in the picture, but you obviously...
I was not comfortable with that, nor did I have that in my closet.
Okay. Well, you look wonderful tonight, so thank you for joining me. Jess, you and your housing team work with our most vulnerable citizens on a daily basis. What does it mean to be homeless today in 2019?
So, I mean, we're here tonight celebrating 80 years of House of Friendship, an incredible milestone. And I don't think 80 years ago, the motivations of people have changed. We all want community, connection, a chance to belong, an opportunity to thrive, and make sure that our basic needs are being met. And I don't think that has changed for the folks that we serve today. I think the paths of homelessness are also likely very similar as they were 80 years ago. Things like mental health and addiction, a job loss, or a breakdown of a family. When I reflect on the people we serve at the Charles Street Men's Shelter, there is a common denominator for most of the folks that we serve, and that is childhood trauma. The people we serve have experienced horrific things in their life. They have seen and been a part of things that you couldn't even imagine. And it is incredible to see their resiliency and what they do. They didn't grow up with loving homes, people that were positive role models, or the chance for education. So really and truly, the folks that we serve, many of them live in a trap of helplessness and poverty. So I wanted to share some of the quotes from the participants that we serve at the shelter that really do reflect that notion. The worst is when you know you are capable, but there are so many factors that get in the way of taking that step. People have no idea. I never thought this would be me. And another participant said, I used to have a family that loved me, and now I don't. They want nothing to do with a bum like me. So why should I even bother being anything other than a bum? That's who I am now. When you hear these words, you can tell the hopelessness and feeling overwhelmed. It's horrific how people are feeling today. And so it's not just this need that people have, but we're experiencing an increased need of sheltering in our community. And so the time for change is really now. When we think about systems and policies and procedures, we need to make sure that we're keeping the client, the people we serve at the shelter, front of mind. If we don't, any system will be ineffective. If the user can't navigate the system, it's going to be ineffective. And so that's why I'm excited to be here tonight to talk about how we're going to integrate healthcare and sheltering to the front of housing.
So, can everyone hear Jessica? We're good? I bet you're having a hard time hearing me, though. Okay. How are people who are experiencing homelessness experiencing healthcare now in our community?
So we've got an entire medical community, many of whom are here in this room, so thank you. 80 years ago, again going back to where we were, 80 years ago there was no universal health care. It just didn't exist. So receiving health care 80 years ago was likely really challenging and was radically different. So today there's OHIP, universal health care, and so receiving health care services should be relatively easy. But it's not in principle. As I said before, if the system's not set up to support the people that we serve, it's going to be ineffective. And so many of the people that we serve at our shelter are in no position to walk into a doctor's office or go to a day clinic. The steps, if you think about the steps of going to see your doctor, booking an appointment, showing up on time, bringing your OHIP card, checking in, waiting, then going, exploring the nature of your problem and your concern. From there, you're processing all of this medical feedback. And then ultimately, most of those visits end up with someone who needs a referral or a specialist appointment or a prescription. It is just too many steps for the folks that we're working alongside. I know I can barely do that on the best of days. So, thinking about those we serve, there are also a number of other additional benefits, or barriers rather, that they're experiencing. You tackle things like mental health, managing schizophrenia, bipolar disorder, or something like psychosis. On top of that, substance use challenges. You could be using crystal meth to stay up for hours and hours on end, or using opiates, a depressant that's everywhere in our community today. Or it could just be a physical challenge, something as simple as a wound that you might have. It could be a mobility challenge, or it could be elements of managing the weather, whether that's heat stroke or frostbite. The barriers associated with homelessness are vast, and ultimately, many of the people we serve end up going to emergency rooms as their primary health care provider. The folks we serve had some perspective around what it was like accessing healthcare in this community, and I wanted to share them with you. One participant said, "I'm so old that my bones are hurting. My lungs can't face the cold of the winter again. My spine is curving so bad that I can't lift my head at all. And the cold weather makes it worse. I won't survive if I don't get into housing. I can't keep doing this." Another participant said when they came into shelter, "When we come here, we trust you guys. You know us. You know what we go through every single day. And some of you even talk to us about being dope sick. You know we aren't going to handle 8 hours of waiting. But here, if a doctor or a nurse is available, we can literally catch them when we see them, and we would know them. We aren't easy to take, and we aren't in the best of moods, especially when we're sick. Some of us smell, some of us are literally at our last straw, and that pressure of trying to be good or trying to fit in and be normal, that alone can make us break. We feel judged everywhere we go. It's no different in hospital. You can feel everyone staring at you when you walk in to wait. It's like we're on display. Just another homeless junkie. That's what I feel like. So John, our participants get it. They can't advocate for ourselves, and so that's why we're here tonight. We ought to bring healthcare into the place where the people are, because they need it.
Lastly, Jess, I just want to ask, and I know you have some of your team here with you tonight. Tell us a little bit about the people who are tackling these challenges.
So first of all, I want to thank everyone for being here tonight. You being here means a lot for our housing team. They've seen it all. It hasn't been easy. It has not been easy. And so by having you here tonight, you're acknowledging that sheltering and housing are important issues in our community. So thank you for showing our team and for showing me that. When it's 2 a.m. and our team at the shelter or in our supportive housing environments are managing a medical emergency, a trauma, an overdose, you name it, it is so important to know that this community has our back. So thanks. I can't speak to everyone's motivation on the team and what brings them into doing this work. Truthfully, it doesn't make a lot of sense. It's incredibly hard. It is heartbreaking at times, and it can be so challenging, but it is beautiful. And many of the people that I get the joy of supporting in our housing services team, they're there because of their heart. They care, they want to make a difference. For me, I reflect back to those women 80 years ago, and it's the chance to do something, to make a difference, and to have an impact. And that's what drives me in this world. We're compelled to do more with love and to make a difference. And our team will continue to walk alongside those we serve every day and every night.
Can we say a huge thank you to Jess and our housing team who do this every day? Thank you. That was incredibly kind of each of you. So, are you still with me? Are you getting the sense? Here's why we're compelled. And so, the outfits look a little different 80 years, but we've still got people coming to the table wanting to make a difference. So, that's why we're compelled. Now I want to share a little bit of the journey that some of us have been on for the last 5 years. 5 years ago, a group of 7 of us, not the group of 7, folks, those are artists, so stay with me, okay? A group of 7 of us went to Ottawa for a visit. We kept hearing about this world-renowned program that they had in Ottawa, and so we thought we were just going to go visit that program. And once we got there, our friends at Shepherds of Good Hope in Ottawa were so kind, and they took us around to all of their programs and got to show us a number of things that they were doing in Ottawa. And throughout the whole time that we were there, we kept hearing about this inspiring doctor by the name of Dr. Jeff Turnbull. You see, Dr. Jeff Turnbull was the chief of staff at Ottawa General for a number of years, and he realized a long time ago that trying to serve our chronic homeless individuals in the emergency department was ineffective and inefficient. It wasn't the appropriate place to provide care. It wasn't working, it was expensive, it was frustrating for everyone involved, both for the individuals being served, for the doctors, the nurses, and also for others who were sitting there in the emergency department waiting for service. And so we kept hearing about this model that they pioneered in Ottawa called Hospital Without Walls, where Dr. Jeff Turnbull said, why don't we actually bring the health care to where the people are, right into the shelters? And so what was fascinating is while we were there in Ottawa and we're standing and we're getting a tour, this thing got to play itself out right in front of our faces. The police brought in 2 individuals. The police didn't even stick around. They didn't need to. They dropped the individuals off at Shepherds of Good Hope right away. And let me tell you, these individuals were not in a good place. Lots of struggles, complex needs. But what I observed and noticed in that time was when they came through the door, they were greeted on a first-name basis. They were known. They were treated with respect and trust. And not that they couldn't be in a hospital, but there's just too much going on. So please don't misunderstand me. We have incredible healthcare providers in our emergency department. But when someone comes in as under the influence of meth or psychosis or struggling with mental health, it actually breaks down the whole system, and it makes it very challenging. But there we were in Ottawa, and these 2 individuals came, nurses came, took their vitals, made sure they were okay, allowed them to lay down on a mat until they came to an environment they were familiar with, used to. And it was this incredible thing to watch. And it was one of those kind of moments where you see something that's so intuitive, so sensible, and you think, oh my goodness, we've got to do something about this. We actually, and so for the last 5 years, we've been chatting with our partners in the police, emergency services, our community partners, and saying, how can we make this a reality here in our own community? And we've been looking at this. And we actually called Dr. Jeff Turnbull and said, hey, our closest 654 friends are coming tonight. And so he asked to share a couple of words with each of you here tonight.
Hello, my name is Dr. Jeff Turnbull. I'm the medical director for Inner City Health, and I'd like to welcome you all to the Friendship Dinner. This initiative that you are embarking upon of shared care in the community, ShelterCare, where you bring services to the homeless and the most vulnerable in your community, and you do that on their terms, is so essential. It has enormous benefits from them in terms of their health and well-being, but it reduces the impact of those services on the hospital, the emergency department, police, the paramedics, and you'll be serving a population that so much needs our care and attention. So it has enormous impact, and it's a very, very important part of the delivery of care to these communities. They'll be served by your initiative in providing better, more appropriate, patient-centered care on their terms. And that's something that we should all be aiming for. I'd like to say that you can't do this without all of the partnerships that are necessary police, the judicial, community partnerships, the housing, the shelter partnerships, and the healthcare partnerships. That collaboration is going to be an essential part of your success. In the end, then, thank you very much for allowing me to say a few words, but I'd like to welcome you to this community, and I look forward to all of your successes in the future. Thank you.
Dave, you can't leave yet. The program's not over. So you've heard a little bit from Jess about why we're compelled. You've heard a little bit about our journey. Still with me? Last one. What is this community vision that we are talking about? Now, before I launch the vision, the community vision that we'd like to invite you in, I need to share a few important things with you. See, when we came back from Ottawa and we had this great idea and we wanted to do things, the great thing about this community is there's already so many great things happening where we're integrating healthcare where the most vulnerable are served. It is not going to be surprising to anyone here tonight that our friends at the Working Center, who already 11 years ago pioneered this, where they integrated healthcare at St. John's Kitchen. What about our friends at Sanguine Health Center, who have literally taken this concept and pioneered taking a support van, here, let me show you some visuals here, of right to where people need health care. The Community Ward Health Link team at our Center for Family Medicine supports vulnerable patients who historically have difficulty accessing care. Our community health centers, Kitchener Community Downtown Health Center, and Langs in Cambridge, send doctors, nurses, social workers to the shelters for several hours every week. And most recently, led by the leadership of the Sanguine team, we finally have our first consumption treatment site in Waterloo Region, thanks to their hard work and many of you in this room. And in a few more months, our friends at the Working Center are going to be opening the Water Street House, where we're all working in partnership, and it'll be our first place here in our community that'll provide 8 or 9, depends on the day when you ask Joe and Steph, but 8 or 9 medicalized shelter beds with 24/7 staff support. So we're actually going to be trying this model on a small level. And here's the other thing that's really happened in the last couple years, and particularly this past year, is that all these organizations have said, let's work even closer together because of how important it is to provide this kind of care for our most vulnerable. And so all of us are part of the Inner City Health Alliance, and I am deeply, deeply honored that all of these organizations that are part of the Inner City Health Alliance have joined us tonight. And they're going to hate me for this, but I'm actually going to ask them to stand, all of them that have anything to do with the Inner City Health Alliance. So don't clap yet, just stand. Folks, I'm watching you. I know you're over there. Thank you, Tanya. I don't think everyone's standing yet. I mean, I could wait here, guys. Like, it's okay. I got time. All right. If we could honor these great community partners who've already been pioneering this. Thank you so much. And they're not going to forgive me for this, and so while I'm already at it, Joe and Steph Mancini, can you stand back up? For those of you who don't know, Joe and Steph Mancini this afternoon got the Doctorate of Law in honor of their incredible community work, so I'd like to just thank them there. I will pay for what I just did, folks. I will pay for it. And while I'm on a roll here, I might as well just say, does anyone else here find the irony that the Mancini's got a doctorate in law? I mean, these are the folks that don't know how to follow rules, and yet here they are. They got a doctorate in law. Something's wrong there, but anyways, U of W, I'm not going to, they're in the room here today too, so I'm not going to say anything. Anyways, congratulations, and a heartfelt thank you to our partners who are allowing this to happen. It's folks who've come before us, pioneered it, tried different things. But tonight, I want to take it a next step with the vision of ShelterCare. I think it's time that we take the solutions of integrating healthcare into all of our shelters across Waterloo Region 24/7. Let's paint the vision here, folks. The reality of homelessness in Waterloo Region is incredibly difficult these days. And I would say particularly the last 2 years have gotten tremendously worse. Talk to any of our community partners, talk to our police, talk to EMS. There has been a shift in our community. And there are a number of factors that I'm not going to get into, and we can all postulate, but the reality is before us. We have a record amount of people overdosing. The prevalence of lethal drugs on our streets are at a rate that we've never seen before. And over 70% of the individuals that come through our shelter are also struggling with severe mental health, physical, or addiction issues. And so you take that, you combine it with the critical shortage of affordable and supportive housing in our community, people not having access to health care at the right time, the overdoses, and you can imagine the position that we put our team members across the region in all of our shelters to deal with very, very difficult situation. Now, on top of that, let's go to our already overtaxed healthcare emergency department, where they're also trying to respond to the needs of the complex, chronically homeless individuals, but they're being taxed, and the services of the police, the emergency, and the emergency department are being taxed. And now picture yourself sitting in the emergency department with your granddaughter, your son, and at the same time there's someone sitting there in psychosis or going through withdrawal from a lethal drug. What's that experience going to be like for anyone? So when the folks we serve do come and they get emergency care, that gets addressed, but then they go back out to the street and the cycle continues. So that's the vision of bringing health care and shelter together to change that. What if they could be in a place and get health care where they're sleeping and get their health care needs when they need them, in a place that they feel safe and trust in? And by receiving that wraparound service from healthcare professionals who know their names, their story, and their struggles, we'll be able to improve healthcare and find stable housing and avoid the cyclical nature. And they can prevent future homelessness. And so that's the vision we're inviting you into tonight. Now here's the deal. This vision is way bigger than us. It's scarier than anything else I've done or looked at before. And our team knows how important this vision is. And they were so nervous that it all relied on me communicating that tonight. And so in their smartness, they thought, man, if he botches it up and doesn't really make it clear, we better have a plan B. And so they were kind enough to call our friends at Tivoli Films and said, here's the vision we'd like to share. Can you just make it very accessible in a short little animation so that anyone who watches it can understand and doesn't need to waste half an hour listening to John explain it? So we'd like to share that with you at this time. Some of you are probably thinking, why didn't they just show that at the beginning and I wouldn't have had to listen to him for the last 30 minutes? And that's not very nice if that's what you thought. So as we all know, you can always pitch a vision, paint a picture, but then how do we move this thing forward? And so you've heard some things tonight, and we don't want to lose the momentum after tonight. When you go home tonight, you'll receive an email that will show you a link to ShelterCare.ca that's just got launched today. I hope you take the time to visit. There's a little bit more information about the vision there. There's a little bit more information. There's some stories about how this could impact and change things in our community. And there's an important little button on that website there at the top that says Join Us. And for some of you tonight, that might just be, you just want to keep up to date with us, and just to, as the thing progresses, you just want to get that information, that's fine. Some of you will say, you know what, I have some skills and abilities or gifts that I want to maybe be a part of this vision. There's an opportunity to do that there. Some of you here tonight came prepared and want to make a donation either to this or the broader work of House of Friendship. So I just wanted to let you know, if you did want to do that, there is in your bulletin, there is that a bulletin. We're not in church, John. In your program tonight, that you can fill out, and there's Yasser will be out there on the way out if that's what you want. So, Margaret, did I get that right? Yeah, it's in the program, I know. So, some of you may decide that you might want to bring forward your skills and get involved in this. Some of you might make some connections between some of the work that you're already doing and seeing how this fits in. You might want to share your ideas or might share what you learned here tonight with your friends or networks. However you wish to be involved, we're inviting you to the table around this vision, and we wanted to say thank you. We're inviting you to the table. 80 years ago, this group of women came together, and in a lot of ways, so much has changed in our community. In 1939, the population of Waterloo Region was 98,000. Today, it's well over 500,000. We're in the top 10 largest communities across Canada. We're one of the fastest growing communities in our province, which is fantastic. But with all that comes bigger challenges, complex needs. And that hasn't ever changed through the 80s. Through the last 80 years. But what has changed is maybe the complexity need, the amount of need as a result of that. But what hasn't changed in those 80 years is people coming together around a table and saying, because of their compassion for others, there's something we can do. Let's come around, let's bring all of our gifts together and see what we can do. And for that, we've set out a few more place settings here for you tonight. Join us at the table. It's bigger issues, bigger challenges, but we've got a bigger table and a larger group, and we want to say a heartfelt thank you for joining us, being with us for the last 80 years, and moving forward into the next 80. Thank you so much for coming tonight.